So we have our database and patient file. Let's get into testing. Click Tests from the home screen. So you'll notice that Tests is broken down into 6 categories. The first is the optional module Quick Screen. Quick Screen is designed to get you in and out of testing as quickly as possible by performing a cursory evaluation to check a patient's general health status. You'll see that you can actually add a new patient right from within Quick Screen. This patient information will automatically create a patient record, which we can open in Patients and add any additional information we want. But for now, let's open our sample patient. You'll see that our test categories are broken down into upper strength, lower strength, and spine motion, and that there are 4 pre-selected tests under each category. Clicking on the test name here will prompt you to wake the device. Push the On button on the device you'll be using, and the software should connect automatically. If this is the first time you've used a particular instrument for the day, the device will prompt you to zero calibrate. Zero calibrate the device as described in the product manual, and click OK. Quick Screen gives us a quick and easy way to perform basic range of motion and strength tests, and also a very easy-to-access report output that documents any deficit the patient may have. This is especially helpful to help quickly justify treatment plans to the patient. Physical Neurological. This section includes tests that primarily use lists, mannequin selection, or radio buttons, and can be based on observations, physical tests, and questionnaires. There are a number of default tests and questionnaires available to the user, and you can add custom tests to these lists using the Custom Test Manager by clicking here. Click the tests or questionnaires to add them to the test playlist on the left. The panel on your left, the playlist, is all of the tests you've added to this particular battery. You can add or remove tests as needed, or move tests up or down, which is helpful when, for instance, you want to group tests together to minimize patient repositioning. You can also load pre-saved playlists, such as common FCE tests or sequences specific to a particular patient by clicking here. We've got the Instrumented section next. Clicking Instrumented will bring up a selection of icons above the playlist that represents all of the instrumented device categories: inclinometry, muscle testing, algometry, static strength, goniometry, grip testing, pinch testing, and isometric testing. Each of these test categories will be covered more in depth in a later tutorial, but let's quickly look at the basics of test selection by clicking on inclinometry. Most of the instrument screens are similar to this one. You'll see a mannequin in the middle, and as you roll over the various body regions, you'll see a highlight. Clicking on each highlighted area will bring up a list of tests available in that region, and then clicking the test from the Available Tests box will add that test to your playlist. As you perform tests, you'll see results populate over here on the right, along with the result, the normative value, the difference to normative, and whether the test is considered valid by AMA or CV criteria. At the bottom, you can see a variety of settings: reps, validity criteria, the order of testing, and so on. In some instruments, you'll also see the ability to select tests by mannequin as well as by nerve root and even the peripheral nerve if desired. All of the instrumented and functional tests in the NorthStar software include multimedia help videos which can help you and your patient understand how a particular test is performed. Clicking the camera button in any test will bring up the help video for that test. Related videos will appear in a drop-down here above the player controls. Close the video to return to the test screen. There's a lot more to instrumented testing, but again, for the purposes of this tutorial, we'll move on. On to functional. Clicking here will bring up some new categories above the playlist: activities, postures, material handling, dexterity, and cardiovascular. As you can see, each category contains additional tests. And again, you can manage custom tests by clicking here. One other important aspect of the test screen we haven't covered is the Functional Test Assistant. Clicking here in any of the functional testing screens will bring down a heart rate interface and posture tracking timers. Simply select a posture you want to track while you continue other testing, then start and stop the timer by clicking here. You can track multiple postures simultaneously, and all of this information is recorded and saved for inclusion in your report. Remember to stop your timers when the patient is no longer demonstrating that position. The hand section of tests is particularly useful for hand therapists and orthopedists. It includes observational data, range of motion tests, grip, and pinch tests also available in other instrumented screens. Also included is a physical sensory test that allows you to document sensory results easily by painting the model with the corresponding color for the sensitivity using monofilament or two-point discrimination. Finally, the last section I want to cover in test is possibly one of the most useful: test sequences. Test sequence allows you to quickly load previously used, previously saved, or even JTEC-provided default test sequences immediately into your playlist. You can reload previously created sequences quickly by clicking Previous Test Sequence here, or previously saved custom test sequences by clicking here. On the right side, we have a number of default test sequences created by JTAC that create a quick test sequence for a variety of standard FCEs. Remember that every FCE is different, and all tests and questionnaires in the default sequence may not apply to what you're doing. If you use a particular sequence frequently and want to save it as a custom test sequence, click the Save Test Sequence button below the playlist to save it for quick retrieval later. That's about it for tests, but there's a lot more to it than we can thoroughly cover in this video. For more information on individual components, you can contact JTAC Customer Service for additional support options.